Hello, everyone. We have a very interesting topic on Saturday today. Our tongue diagnosis. Did you know that the tongue, the color of your tongue? I don't know. I don't see my tongue every single day in the morning, but the tongue can tell you a lot about your body. And that's what we're going to be talking with acupuncturist from Italy, Federica. So who will be joining me in 1 second, and she'll be talking about how can the tongue, your tongue diagnosis, and what it can tell you about your different parts of your body, different parts of things that something might be wrong with you. So Dr. Federica Quinter from Italy, and she'll be talking about that. So hold on to your questions. Hopefully she can. Oh, there you are. Hi, ciao.
Yes. Hi, can you hear me?
Yes, yes. Thank you so much.
Yes. Okay.
Yeah.
Thank you for having me. So good to see you.
Yes. Well, I hope everything is open in Italy. So we are thinking California is closing down right now from tomorrow. So it's
Oh, wow. Yeah, Italy is a bit different. Like we have different closures in different parts of Italy, like the northern part, it's a bit worse. And I am in Rome and I'm still able to go to work but we have limitations, of course.
okay. So we have a very interesting topic, everyone. Thank you so much for joining us. It's tongue diagnosis. I think it's fascinating. Maybe Dr. Frederica, you can tell us a little bit about yourself before we go into this tongue diagnosis, which is a fascinating topic.
Sure. So my name is Federica Quintarelli, and I am a Western medical doctor here in Italy, and I live in Rome. And I also studied Chinese medicine, traditional Chinese medicine, or TCM, as you can call it. And so I try to combine both in my practice because I really believe in a holistic approach to the patient and to the disease. So I like to combine both my doctoral degrees.
That's
And so,
fascinating. 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 So let's talk about the tongue diagnosis a little bit. And then we come to
sure.
your MD as well. This is
Yes, so tongue diagnosis is a very old technique of diagnosis that really dates back to the classic books of traditional Chinese medicine, which is the Yellow Emperor at the Yellow Emperor time, and together with post diagnosis is the main diagnostic tool that we use as Chinese doctors, and the characteristics of the tongue are they really give a view on overall health of the patient. So it is like a mirror of our internal health, like how every organ is, and how the whole body is balancing energy. You know, Chinese medicine is very much about balancing the yin and the yang energy inside the body. And so, just observing the tongue, we can have so many important details that will be important in assessing a diagnosis.
wow,
So,
wow.
for example, when we look at the tongue, we really have to look at the shape of the tongue. Like it can be a regular tongue, or it can be thick or thin,
Okay.
and okay. And then, of course, many patients, they feel very shy to show the tongue because it's something that we are not used to in the West.
Yeah.
And they're afraid that maybe it's dirty or something, so they don't want to show it. But when we ask to look at it, it's just because we want to understand like the general health of the patient. So, of course, the color is one of the first impressions we have when we look at the tongue. And a normal tongue should be pink.
Pink. Okay.
Yes, light pink. And it can be also red or purple, which means that there may be a lot of heat in the body or blood stagnation if it is purple, or it can be pale, so very light pink. That means that there may be Qi deficiency. or we are going to look at the coating of the tongue. So the white coating that we have, if it is too dry or if it is too thick, that could be a sign of dampness in the body. And then something else that we look at is if there are particular signs on the tongue, like there can be cracks on the tongue. Maybe someone looking at his tongue, they will see some cracks in the middle or anywhere. And so different parts of the tongue are like a mirror of some of different organs. Like, for example, in the back of the tongue, we have the intestines. In the middle, we have the stomach. At the side, we have the liver and gallbladder. At the tip, we have the heart. So according to where we have the signs, that can be a sign of that particular organ. Like, for example, some people looking at the tongue, they might see teeth marks at the borders. That might be a sign of some problem on the liver.
Or teeth mark on the side? On the
Yes.
side? Oh.
Yes.
And then you talked a little bit about the yin deficiency. So what are the signs of, like, how can you tell this the yin deficiency is looking at the tongue?
Yeah, so yin deficiency is often related with, so yin is our energy, that is the nourishing energy, so mainly the blood for women and the thick fluids. So when we have lack of this, we will have, since TCM is always a balance between yin and yang, we will have a yang excess, like an empty heat that shows in the body, like you suddenly see a lot of heat on top of the body. So the tongue will be very red and dry with cracks all over the mouth.
Okay. Oh, red and dry. Red and you said
red and dry. Yes.
Red and dry, and that denotes the yin deficiency in the body.
Exactly. Yeah. And so some symptoms can be hot flashes, irritability, insomnia, feeling thirsty, having irregular periods. Those are all signs of yin deficiency.
Oh, got it. And you can tell just by looking at their tongue and also some of the symptoms that the patient is experiencing or a client is experiencing from that?
Well, I have an idea, and then about the appearance of the tongue, I start making specific question to the patients. So I will ask, how is your period? And sometimes they will say, oh, it's irregular, or it's maybe it's deficient, like with poor blood. Or I can ask, how do you sleep? How much water do you drink? Because nowadays, this is a very common pattern in women.
Yeah.
Because lately, women are working very much outside, much more than many years before. So we live in a sort of young excess. And that shows also in our bodies. Like, we don't rest, we don't meditate, we don't take time to go slow and just relax. We don't have proper meals sometimes because we rush. So we just eat something very, very fast, or simply we don't do the yin part of our life. We are always rushing and working and being overproductive, over exercising at the gym. All of these things can lead to a yin deficiency, which is something that I see very often now in young women.
So now let's say you figure out there's a yin deficiency through the tongue analysis, through your questionnaire. So what are the different steps that you will take? Would you combine, obviously, acupuncture, since you've done acupunctures, but would you also combine integrative medicine, like, you being an MD?
Yes, of course. So for sure, I would ask for some blood tests and see if there are some vitamin deficiencies, like maybe the B vitamins deficiency, like B9, which is folic acid, or B12, or maybe some iron deficiency. Of course, I would recommend to I would also give some dietary prescriptions, because as a Western doctor, I also have a focus on functional nutrition. So, of course, I will give a diet that will be very nourishing, with some food that may be in natural, warm or neutral temperature, and with a little, they should be a little sweet and bitter food that can dry out the heat, the excess heat that the body has, and nourish the spleen. So there are many things that one can do while working on a patient.
Sure.
And also would recommend, of course, some omega-3 supplements, because they are very nourishing.
Yeah. So omega-3, bitter foods, right? Generally, just on a high level diet, and then also some acupuncture sessions and acupuncture herbs as well to balance it. Yeah.
Herbs as well, of course. There are many herbs that can help with woman's health, and the most important is Rehmannia, which is very famous. It's in many women's formulas, so for sure I will combine also some herbs like this one. Yeah.
So what can we do to keep our tongue pink? That's what you talked about. Keep your tongue pink. So what do you do?
It's all about finding balance. It's not that you can just wash it in the morning and it's fine.
Drink in the morning.
No, you have to find the balance. So of course, working, but then having time to rest, having a good diet, also knowing how your body works, because we are all different. Like, we have different constitutions. That means our organs have different energy according to our body constitution. So maybe some people tend to overwork on the liver, some tend to overwork on the kidneys. So each one of us should know which organs it needs to support.
So how do we know that? As a user, I have no idea how my body is working. I wish there was a magnifying glass where or some kind of an app, right, that I can tell which organ is out of control, right? But how can we what kind of symptoms should we look for, when we're going out of like fatigue or some kind of a mood disorder or these kind of things, you think?
Yes, all of these questions can give you an overall idea of what is the imbalance in that body, and so what should you do to address that imbalance and keep it and take it back to normal. So it's there are many questions that we ask: how you sleep, what color do you like, how often do you drink, if your periods are regular, how is your digestion, all of these things, how are the stools, what do you dream. Also, there are many things that, yes, also dreams speak about specific organs. Yeah, if the dreams are very vivid, also it's something that is related with the liver. So there are little hints for us doctor to make a whole picture of the patient.
So things like sleep, you said, digestion, bowel movements, of course, diet, right? And dreams.
Yes.
You said the dreams and the sleep pattern.
Yes.
So if anything is going out of control or not in balance, then it will reflect on our tongue.
Yes.
Right? And
right.
of course, the tongue is the mirror of image, like you said, of our body. And if something is not functioning properly, the tongue, you'll be able to see from the tongue. And then on an average person, we should make sure that if the tongue is not pink or it's coated with white, then something is wrong, right? That's what I just want to make sure
Yes, that is something that everyone should look, just to know what patterns does he has on a regular basis, like looking at your tongue maybe once a day or
Okay.
even once a week can be fine, just to see if there are slightly variation
Okay.
from a time to another,
Yeah.
and see, okay, maybe now I'm not sleeping good and I see that also my tongue is different than
Yeah.
last month. So
Yeah.
it's something that we should know of ourselves. It's also a tool that we can use as individuals to check our health, because after all, everyone is his first doctor,
Thank you.
right?
Thank you. Yes, no, it's very informational. Any questions, anyone who's watching us, you're welcome to put the questions in.
Yes.
And if you can't think of a question right now, we just wanted to bring this topic out because tongue analysis has been, I've seen so many articles, but really didn't understand. So I really wanted to bring Dr. Federica here to really make us understand, how the tongue can reflect, like she's talking about, mirror of our body. Anything else you would like to add, Dr. Federica, before we wrap up today?
So something else that we can see often is qi deficiency,
Okay.
even after someone maybe, because qi is our vital energy in Chinese medicine, and it we have uh, a qi that we born with, that is ours, that is in our kidneys, and then we have many forms of qi. So we have the Wei Qi, which is the defensive Qi, which is like our immune system that protects us at the
Yeah.
exterior from external pathogens. Then we have the nourishing Qi that comes from food, the Qi that comes from the air that we breathe, the Qi that we have from the relationships we have. So also a very common pattern is a Qi deficiency. So
Okay.
in that case, the tongue is thicker, like it's swollen,
Okay.
and it's usually pale, in contrast to the yin deficiency when we said it was very red and dry with cracks. In
Yeah.
this case, is pale and larger, yes, and you can also have the marks on the side because the tongue is so swollen that touches the teeth. And so in this case, you will feel like chronic fatigue, poor appetite, worrying, overthinking. And you can commonly see this pattern after if one was sick with fever, with some infections, or if he has a poor diet, poor sleep, so he's not nourishing his own qi. You can have this pattern. And as well, we have a lot of herbs that work very well on this pattern. And I have some here at home that I wanted to show,
Yeah.
because there are some herbs that I'm taking right now, because of COVID. So I'm trying to keep
Okay.
my qi up, especially my Wei Qi, which is the defensive qi, so that I can stay healthy and keep working to help my patients. So some very useful herbs are the Atractyloides, which is this one,
Oh, okay.
the root,
Wow.
yes. Then we have the root of astragali. This is it's still a root, but it's smaller. See,
Yeah.
it's little round like this. And a very important herbs to strengthen energy is the ginseng. We
Ginseng.
already know that.
Yeah.
Yeah, this is dried American ginseng. And what else? well, also cinnamon.
Oh, cinnamon. So just
Yes,
in
so
the tea. Yeah.
some of these are herbs that we can find in our kitchens. Also, sage is very good for qi. So you don't really have to take only Chinese herbs. Some
Yeah.
herbs can be already in your kitchen, even if you don't know anything about Chinese medicine.
That's right. So balance the qi and the yin. These are the two things that tongue can help all of us self-inspect and see if there are any basic issues like you
Yeah.
talked about, right? You talked
No, I
about.
mean, you can see every pattern on the tongue. You can see normal yin
Yeah.
deficiency, uh, yang deficiency, heat
Hmm.
excess. You can see dampness. You
Wow.
can see you can see every of these patterns on the tongue. But since we have a few times, we are
Yeah.
just talking about a few patterns that people could recognize that are very common.
Absolutely. And, we'll, if there is, we can continue with other discussions, like dampness and other things that you're talking about in our subsequent sessions. Today, these are small sessions. These are meant to be
Sure.
educational and, and really advocating natural medicine, Chinese medicine, acupuncture to the users, to how you can do self-care. That's the really intent of these sessions. And we have experts like Dr. Federica, who's joined us from Italy. So thank you so much for being with us.
Thank you, Amita, for inviting me.
Yes. To all our viewers, thank you so much for watching, and please help us share these sessions to help advocate natural medicine. Thank you so much. Bye now.
Bye.